When you think of getting your eyes examined, you might assume the only thing you're helping is your vision. But these exams tell doctors so much more about your overall health. Eye Care Associates Dr. Benjamin Lee is here to talk about that. And what more can an eye exam detect, or what are you looking for?
Well, certainly we're concerned with vision, but there's several systemic diseases that sometimes we're the first to pick up, or certainly that we need to monitor, for complications, things like diabetes and high blood pressure, certain autoimmune diseases like rheumatoid arthritis, can have implications in the eyes.
So you actually can see these sorts of things starting within the eye area?
Sure. I mean, like with diabetes and hypertension, a lot of times you can have bleeding in the back of the eye that you'll pick up with retinal photography or examination with a dilation. And then you can kind of follow that along in terms of what needs to be treated and what just needs to be followed and monitored along with their regular primary care physician.
Okay, and do you work with those primary care physicians when there
Sure.
might be a diagnosis of rheumatoid arthritis or something that could affect the eyes?
Sure, and a lot of times that would be managed with a rheumatologist who specializes in those types of diseases. And both the complications and some of the medications that are used to treat those types of diseases have eye implications. So yes, we work pretty closely with a lot of those specialists.
Now, can your eyes affect your immune system, or you can see an immune system disorder?
Well, certain immune diseases or autoimmune diseases can cause, dryness of the eyes, which is a really common thing. Certainly not everyone that has dryness of the eyes has any type of immune system compromise, but there are certain diseases that can cause real significant dryness of the eyes and discomfort, and that can lead to visual implications as well.
Okay, so how often should we see our eye doctor?
We recommend everyone, really from kindergartners up, see their eye doctor every year. I mean, I think it's just important to make sure they're functioning at a very high level visually. It helps with kids' efficiency in school and with them deciding that they're one of the smart kids, that things go well for them. And it's important for adults to function at a high level at their job and, for our enjoyment. But it's also important because of these systemic disease states that can be picked up and kind of some of the clues that can help us decide that maybe somebody needs, specialist care. So I think it's important for a variety of reasons.
Yeah, so it's not something you should just wait on when you have a problem. You should be much like preventive or maintenance care.
Absolutely. I mean, we encourage patients to have an annual eye health exam, even if they feel like everything's going well. And sometimes we worry more about the people that have quite good vision because they feel like there's very little need to go to the eye doctor. And, that may well be true with the vision. We may not find anything that we need to get excited about in that regard, and that's fine. But we do like to do all our health screenings and our health checks. And it's such a small amount of time and such a small expense on a relative scale. I just feel like there's a lot of benefit.
Sure. Okay, well, Dr. Lee works out of the North Raleigh office of Eye Care Associates, but the doctors at each branch are ready to help you. So you can check out eyecareassociatesnc.com to learn more about the practice and also to find the closest office to you. Thank you so much, Dr. Lee.
Sure, absolutely. Thank you.
We'll be right back.